A question here, a client with cancer pain and prescribed oxycodone. Which teaching is the most essential to help to prevent the long-term complication? Our patient diagnosed the cancer and patient have a pain. Doctor prescribed oxycodone. Oxycodone is an opioid or narcotic. They have a long-term complication. So out of 4 options, which one is most important education we need to teach our patient to prevent the long-term complication? Before to go to the read one by one, I want to go to tell you what are the different opioid name or narcotic type we use in the hospital. We use codeine, demerol, hydrocodone, morphine, oxycodone, heroin, meperidine or hydromorphine, oxymorphine, and also fentanyl, most commonly used. So there are 4 options. Teach the client how to assess the blood pressure daily. So blood pressure drop because of opioid, it is normal, but not a long-term complication. Teach the client how to prevent complication. So constipation. So constipation is a long-term complication. So we have to educate our patient how to prevent constipation, because constipation one of the long-term complication because of oxycodone or morphine. Teach the client how to prevent itching. So nothing itching occur because of opioid, or teach the client how to prevent nausea. Also, nausea or itching, not a long-term complication because of oxycodone. So before to go more explanation, I want to tell you what are the common complication or side effect if anybody use the opioid. Let me read it first. So common side effect for all opioid or narcotics are easier to remember: A, B, C, D. A stand for alter the vital sign. B stand for blur of vision. C stand for constipation, confusion. D for dizziness, dry mouth, distension of urinary bladder or retention of urine, and sedation. So the NCLEX tips from today, you could remember all opioid or narcotic side effects are A, B, C, D. A means altered vital sign, means patient develop low blood pressure, low pulse rate, low heart rate, hypotension, bradycardia, bradypnea. And B for blur of vision, B for bradycardia. C stand for constipation, C stand for confusion. So D stand for dizziness, dry mouth, and distension of urinary bladder or retention of urine, and also sedation. So if your patient this type of side effect, what you tell your patient? Very important, right? So all kind of opioid or narcotics we supposed to use for pain medication, but they are very addictive. It is good to use only for short time. And if your patient have to take opioid, we could observed for respiratory depression, because this type of medication can causes the respiratory depression. So next here, go for explanation. Oxycodone is a morphine-like opioid medication. Opioid medication bind to the opioid receptor in intestine, which slow the peristalsis and increase the water absorption and lead to constipation. This question about the long-term complication develop the constipation, we are going to focus here. Constipation is almost universally expected side effect for opioid medication. The client will not develop tolerance to this side effect, although the client with idiopathic chronic constipation are not commonly advised to take laxatives. Opioid-induced constipation treated with simultaneously use of stimulant or stool softener. Beside of this, every student must know the nursing intervention if your patient should take opioid. Opioid promote the sedation. They can cause dizziness. Educate your patient. Don't go for any machinery work or driving the car, right? So it is good to avoid with other medication causing central nervous system depression like monoamine oxide inhibitor or antihistamine or muscle relaxant. Now, let me go. What are the education objectives? Constipation is an expected long-term side effect of opioid. Client will not develop tolerance to the side effect. It is important to teach aggressive preventive measure that is defecate when the urge is felt, and drink at least 2 to 3 liter fluid per day, high fiber diet, and exercise. Also, simultaneously use of stool softener or stimulant can work. So this question about the oxycodone, also it is important to know if sometime patient has an allergic to aspirin, so it is okay to give the patient who have allergy to aspirin, they can take the opioid.